All right, it's a brand new year, and it's time for us to continue our advocacy as it relates to how we can keep ourselves safe and healthy in the year 2026. So this morning, we're doing an advocacy on cancer awareness, but not all types of cancers. We are talking about cervical cancer. I understand January is often referred to as the Cervical Cancer Awareness Month. And so let me bring in my guest to the microphone. Dr. Eben Ajay is a consultant clinical and radiation oncologist at the Medserve LUTH Cacner Centre right here in Lagos, Nigeria. He's a member of the West African College of Surgeons and, of course, the Medical College of Radiologists in Nigeria. All right, the Association of Radiation and Clinical Oncologists right here in our country. And, of course, the Nigerian Medical Association is also a member of that particular prominent group as well. He has very keen interest in treating head and neck as well as colorectal cancer, prostate cancers as well, using what we refer to as cutting-edge radiation methods. He also has background in molecular genetics of cancers, which enables him to really apply personalized and targeted therapies to his patients. So I can tell you, he has really done a whole lot of work, not just in treatment, but of course also when we are making reference to research as well. Dr. Eben Ajay, it's nice to have you in the studios once again. Good morning.
Good morning, sir. Good morning, everyone.
And Happy New Year to you.
Happy New Year to you too.
All right. So how is Medserve? How are you guys faring?
Well, we're doing very well. We are still in the forefront of cancer fight, and God is helping us.
All right. Medserve is a specialized medical facility?
Yeah, it is. It's a medical facility set up by the NSI in conjunction with the federal government.
All right.
And the sole aim of that is to reduce the cancer burden in Nigeria.
So far so good. Are we winning the war against cancer?
It's a gradual war. It's not a sprint. It's a long haul. And we've covered significant grounds and we'll continue to cover more grounds. Okay,
which is very good. Let's focus on the area that we're looking at this morning, cervical cancer. And I understand January is often referred to as the Cervical Cancer Awareness Month. Any reason why it has been designated so?
Women run the world.
Oh, women rule the world, right?
Yeah.
Okay, so we're just trying to focus on women?
Yes, cervical cancer is a cancer that affects the women folk, and it's important because it has a very significant public health implication in terms of its disease, in terms of the history, in terms of its implication, treatment, and complications.
Right.
So I think it's a good start. We look at cervical cancer. And, right. I mean, of course, that explains why it's coming tops in the awareness list.
All right. So for those who might not know what we're really talking about this morning, cervical cancer, what kind of cancer is it?
So cervical cancer is the cancer that affects women solely. Is the cancer of the female genital tract. So if you're looking at the female genital tract from outside inwards, you have the introitus, then you have the vagina, then you have the cervix, and you have the endometrium. The endometrium branches into two string cords that attaches to the ovaries. So that is the anatomy. And the cervix is about 3 to 4 cm in length in tract. Okay. So it's usually the initial part of the womb, that carries the baby.
Right.
Yeah.
So that's where it is located?
That's where it's located.
Okay, so what's the difference between that and... Because I know I hear of ovarian cancer too.
Okay, so they are all gynecological cancers, except that for the ovaries are attached closer to the pelvic walls, while the cervix is in the female genital tract.
Okay. That's where it's located, right?
That's where it's located.
All right. So how prevalent is cervical cancer in our country?
Cervical cancer is very prevalent in our country. The prevalence is very high. It's almost like looking at the numbers of the women folk that we have in the country. The incidence, according to WHO, I mean, it's over 20,000. Per 100,000 of cases that we have, and the mortality is quite high, about 8,000 deaths we have yearly. So it's very important that we look at the subject.
So if there are 10 women in this room?
If there are 10 women in this room, at least 2.
2 of them?
Yeah.
Wow. That's high, really.
Yeah.
All right. So, what are the most common risk factors?
Okay, so it's important that we look at risk factors while we're discussing cervical cancer. The very important ones that we should look at is early sexual exposure of a girl child.
Early sexual exposure.
Early sexual exposure of a girl child. Now we look at a situation whereby girls of 8, 9, 10 years are beginning to get exposed to sexual activity. It's a very important risk factor.
Ooh.
Now, another risk factor is people who have multiple sexual partners and partners with multiple sexual partners. So invariably, you're not just having relations with your partner, you're having relations with other partners that your partners are having relations with. That's important. Multi-parity.
That's a very complex web.
Yes, it is. It's a very complex web, and you discover that as the web fans out, there are more people who are attached to people who are attached to other people who someone may be attached to. So invariably, for those who may be a little carefree with their sexual life, you might just discover that it's not just your partner that you're having relations with. You have someone who's having relations with other partners, so you're technically having relations with 3 or 4 other people that your partners are having relationship with. And when they catch that infection, invariably you are going to be infected too.
As well.
Yeah, because it's the agent is the human papilloma virus that is gotten through exposure, indecent exposure, with sexual activities and all of that.
All right. Okay, that's a risk factor, right?
Yes, the risk factor.
Any other one?
So, any other risk factors are associated. We could look at alcohol consumption, cigarette smoking. We look at low socioeconomic status, and this rides on the fact of maybe poverty and low education. With low socioeconomic factors, I mean, the average girl child who is neglected and wants to make a living at life will likely go to have extra marital relationships or have a bobo or somewhere, who may not definitely be faithful, but she's in that tango because of the financial benefits she's getting. So that makes her at risk of cervical cancer.
All right. There's some common trends and some emerging trends today in our world. Eggs harvesting and all that. Is that a risk factor?
No, it's not.
It's not.
It's not a risk factor.
Okay.
It's not related.
I just want to be very, very sure about that.
No, it's not a risk factor.
All right. So let's look at some common myths and misconceptions about cervical cancer. Do you have anyone? I mean, you are a medical doctor, and quite a lot of times people come up with one thing or the other. So, have you heard of any myths or misconceptions about it?
Okay, so the common misconception about cervical cancer is the fact that if you get it, if you are exposed now, then you come down with the disease. No, it's not. It might take a period of 6 to 10 years before the person
it
manifests. So, and women should get tested. When they get tested, then they can now begin to plan their life on a safe path, because even at infection, when you're infected, you don't come down with the disease immediately.
I'm looking at that now. 6 to
10, sometimes to 20 years before they come down with the disease. And that also depends on the frequency of exposure to the infective agent. So someone who accidentally, maybe for some reason, had one exposure unplanned, yes, that person may be at risk, but it's not at risk as someone who, for example, is a commercial sex worker. Someone who is a commercial sex worker, or someone who does runs as a means of livelihood, then you are at higher risk than someone who maybe apparently was just raped all of a sudden, and may not may not definitely be her kind of lifestyle. So those are the common myths associated with it.
Wow, that's scary. For the way you described it now.
Yeah, but that's the reason why we're having this conversation, so that there can be more awareness out there, so that people can know and people can have a positive outlook towards life.
Okay, let's look at the signs or perhaps the symptoms that would show that somebody is coming down with cervical cancer.
So the most common is bloody vaginal discharge outside the woman's menstrual cycle. So every woman who's reached maturity will have this regular calendar menstrual cycle. So when you have that discharge or bloody discharge outside your menstrual cycle, is a red flag. Now, when there is a bloody discharge that comes after coital exposure, is another red flag. So you meet with your bobo and after the whole thing, you are bleeding outside your menstrual cycle, is another red flag. Then it progresses towards having a watery, foul-smelling discharge. So when the discharge is becoming watery and foul-smelling, the disease is obviously progressing. There's superimposed infection on those masses that appear there, because they are essentially fleshy growth that occurs within the region of a cervix, either inside of the cervix or outside of the cervix. So you can understand where coital exposure, the male organ hits on it, it will bleed. Then when those things, as they grow, they might rupture while they are forming new masses there, then they bleed. Aside that, other advanced symptoms may be swelling of one leg or both legs, swelling of the abdomen. They could have low back pain. They could have headaches. They could have constitutional symptoms. But as the disease spread, then you cannot talk about symptoms that are suggestive of secondary organ affectation, which may come down with cough, it come down with yellowness of the eye or yellowness of the urine, and abdominal swelling, abdominal distension, as the case may be.
Wow. So these are all signs I want you to watch out for.
Yeah, I want you to watch out for.
All right. Is cervical cancer, is it curable?
Yes, it is curable. It is curable, but that depends on a number of factors. It depends on the stage where the person presents to the hospital. It depends on the care the person does have. It depends on the risk, that we talked about earlier. So if someone comes in at a stage 1A, for example, where you have the mass that can be easily removed at surgery, then the person can have the treatment, have it removed, and the person can be monitored. But someone who comes in at stage 3B, stage 4A, which are signs, which are the extent of the advancement of the disease, then you discover that cure may not be that easily achieved.
Wow.
But it's curable.
It's curable.
Yeah.
All right. Lagos Traffic Radio 96.1 FM. This morning, we're doing an advocacy on cervical cancer. Precisely, we're looking at it from the fact that this is Cervical Cancer Awareness Month. And Dr. Eben Ajay is here. Of course, he is of the Medserve LUTH Cacner Centre. Getting back to the roads, the Ekpe corridor, presently very good within the coverage area with very, very smooth movement from Mojoda linking up with Itamarun, Itaokpo as well as Ayetoro, all looking pretty good. From there, inwards General Hospital Junction, linking up with the T Junction, Temu, Okyoshu, down to K2, very much in good shape at this hour as well. We can tell you that it's also a very good travel if you're moving in from the T Junction, linking up with Alaro City, Elenrogbe, Okeogun, Ibeju, Kara Market, as well as Eleganza and Kayetoro and Eleko Junction. All those corridors looking pretty good. Return journey from Eleko Junction is applaudable down to Kara Market, proceeding through Ibeju, Okeogun, linking up with T Junction, and likewise from there down to Kyushu and K2 is also very much in good shape. We can tell you Ayetoro and areas like Itaokpo and Itamarun down to Mojada is super fine at this hour. All right, impediments remains very, very negative if you're navigating through that corridor as well. You can also share your own travel experience with us as you drive through this wonderful Friday morning. Feel free to connect with us, and then we will to escalate that to others as well. Okay, so Dr. Ajay, get about it. You said it's curable, right?
Yes, it is.
That's one of the rare cancers that can be cured.
Yes, it is, because the causative agent is known. So it's behavioral modification, it's counseling, and it is treatment. With all of this tripod, we can cure the disease. And I'll just take a moment to talk about prevention. Now, government is doing a lot, in sensitization and in educating people for immunization. And let me give you this example.
Tell me.
Yeah. So you become governor of Lagos State today, and you have an 8-year run, and you say that, okay, every child that comes into GS1, right, of every secondary school should have vaccines. Right, the Cervarix vaccine and the Gardasil vaccine. Okay. Now, it's something that can be done within 6 months. The first exposure, the next shot, and the last shot. And these children are vaccinated all over Lagos State.
So it can be prevented through vaccine?
Yes, it can be prevented through vaccine. Now, you run that program for the next 4 years of your term and the second 4 years of your second term. So you have immunized children who would have been in second year of university by the time you're finishing your 8-year term. Now, your successor comes in and runs another 8 year following on your program. Now, they would have immunized another set of children who, by the time they would have been finishing their program, your children that you have been immunized at year 1 would have been would have been married and would have joined the workforce. So if we have 3 governors who run 8-year terms, the 3 of them in 24 years, you could discover that cervical cancer will not be an issue anymore, because you would have taken care of it at a very at a young stage, at inception, with children. Now imagine if all other governors queue behind you and you run that for the 36 states of the country.
Wow, that would be phenomenal in terms of success, right?
In terms of success.
So do we have communities, or perhaps do you have countries that have been able to eradicate cervical cancer like that?
It's low in the West. Why is it low in the West? Because sensitization, government initiative, and the support that the inhabitants the populace give to follow government program. Because a lot of the challenge we have is the perception of our people. Our people believe that vaccines is sterilization, vaccines will have some other effect, and that is why they will not allow their children to be vaccinated. And as long as we have this perception run in our communities, then the disease is going to stay with us and will not be able to eradicate it. Because cervical cancer is one of those cancers that is curable, is one of those cancers that can be avoided, is one of those cancers that can be treated if necessary steps of sensitization and awareness are taken.
All right. In terms of treatment, how cost effective? Okay,
treatment is very cost effective. Now, I will just continue to emphasize on the fact that the stage of presentation is key. So, at early stages, stage 1 and 2, you can do surgery. In fact, very early stages, the pre-malignant stages of the CRN 1, 2, 3, surgery will take care of that. Other modes of surgery, sophisticated form of surgery, less invasive forms of surgery are available that will take care of pre-invasive stages. So if you talk about the invasive stage, it's still surgery will do and radiotherapy will do. Then the more advanced cases is where you have to do chemotherapy and we have to do palliative radiotherapy, unfortunately, where the successes are rather low in those late stages.
All right. Okay then, Lagos Traffic Radio 96.1 FM. It's time for you to also join the conversation. Feel free, 080-99120777 and 09153877127. Feel free to ask the doctor any question that relates to this. We're doing cancer awareness, but this time around, it's all about cervical cancer. It's a cancer that affects women and not men. All right? Feel free to ask your questions this morning. Doctor, any success stories to share with us?
Yes, they will have a lot of success stories. Well, it's just unfortunate that with us human, it's the bad news that makes rounds. Yeah, there are success stories we have in Medserve LUTH Cacner Centre. Those who've come and we're following up 5 years, and I mean it's still on, and it's our call to tell our viewers and our listeners that early presentation, as soon as you notice the symptoms, is the surest way and the best way to which you have a cure.
How important is early detection?
Early detection is a primary level of prevention, so it's as good as nipping it on the bud.
All right, so I'm just wondering, are there new developments or perhaps new advancements in cervical cancer prevention?
Yes, so what we used to know is the pap smear.
Okay, just a second. Let me see if I can just sneak this call in. Hello there. Good morning. Yeah, good morning.
Comrade Daniel, I'm on the line.
Yeah, Comrade Daniel, how are you doing?
I'm good, and you?
Very good too. So I have Dr. Eben Ajay here with me.
Yeah, good morning, Dr. Eben.
Good morning, sir. How are you?
Yeah, I'm good.
Good.
Yeah, and you? Yes, LUTH Cancer Centre. I think I had the opportunity to be there before, just though I visited the admin.
Okay.
But what I saw was something to behold. Very wonderful and beautiful places where the treatment of cancer has been taken care of.
All right.
I commend whoever the government and people who have worked to build that center.
Okay.
Thank you.
Indeed, my question is that for those girl child who is not involved in any of these maybe multiple partnership and promiscuities, who is decent and so on, could they come to be affected with this cervical cancer?
Okay.
That's my question.
All right.
And secondly, when a child is born, there are a series of immunization being carried out on that child before to a certain age.
Right.
It's also the girl child part of what the inoculation involves. That's my question. Thank you very much.
All right. Thank you so much for your question. Girls that are not involved in having sexual intercourse, could they still be affected by cervical cancer?
Okay, so if you look at it on the surface, no. If there's no penetration, you may not be involved.
Okay.
But we know that there are other forms of sexual exposures now. Oral sex, would you call that intercourse?
No.
Okay, so that's not intercourse. So if a girl child would be engaged in oral sex, yes, it would be infected. If the partner is already infected, has the virus in the oral cavity, so the girl child can be infected. But the surest way, because that will link to the second question, is the fact that they should have that girl child vaccinated. So vaccines are available from age of 9 to 14, or age of 10 to 15 for the male child, or 9 to 14 for the girl child, because we know that development occurs faster in the girl child than the male child.
Can ladies that are already exposed to sexual intercourse still get the vaccine?
So research has shown that the vaccine may not be effective in those who are already exposed to sexual intercourse, because it doesn't give, the vaccine doesn't give any extra advantage. However, if the exposure was a one-time thing, an accidental thing, right? Now, you could protect yourself if you have that vaccine. But the vaccine does not confer any added advantage so far you've had an active sexual life.
Okay, 08099120777 and 09153877127. There's a message here. It says, please, doctor, my sister is 32 and she complains that she bleeds after sex sometimes. Should we be worried, or is it normal? Chidima is sending that one in.
Okay, so it's not normal if she bleeds after sexual exposure. So my level of worry I would want to recommend for you is to take your sister for a screening. There is a liquid-based cytology, is a DNA-based test that can be done, that will determine if she is exposed or she's not exposed, if she has the virus or she doesn't have the virus.
Okay, all right then. Chidima, I hope you got that. 08099120777 and 09153877127. There's a message here. Cavalry greetings, Vicky D. This is Biodun from Adiyon in Ogun State. Biodun, thank you so much. He said, please, I have these questions for Dr. Ben. He says, what are the stages of cervical cancer? Say 2. How can I prevent cervical cancer? 3, say, is there a free cervical examination? Cheers, Vicky D.
Okay.
All right. Thank you so much, Biodun from Adiyon.
Okay. So there are 4 stages, like every other cancer. So with the staging of cervical cancer, but I would just want to add the pre-invasive stage as stage 0 to cervical cancer. So the staging of cervical cancer would depend on the extent of the spread and the size of the tumor. So it has a stage 1, so a stage 2, so a stage 3, and lastly to a stage 4. I will not bore you with the details.
All right.
Free cervical cancer screening, well, I know that it is available in LUTH for secondary school, up to secondary school children can come to LUTH up to secondary school children to have cervical cancer screening. If it's available in Ogun State, I will not have that information. Then I've forgotten this last question.
Okay, it was talking about, let me open that message again. So it was talking about, okay, let me just get that, 08099120777. So it's how can I prevent cervical cancer? And the last question, is there a free cervical examination?
Okay, so how to prevent cervical cancer is from 1, you need to, there's there's a vaccination option that is available. We talked about that. There is also counseling and change of lifestyle. That is a primary way of prevention. And part of prevention also is the other lady who mentioned the history of postcoital bleeding. You take yourself for a screening and you take yourself for possible treatment if any evidence is found of any masses.
So after this cure that we're talking about, can a lady return to normal life?
Yes, can return to normal life. So after a series of investigations that are done and treatment, whichever treatment that is done with the respective stages, she can return back to her normal life. We have people who've been treated who are back to their jobs, they're 9 to 5 and they're doing great. All
right, this one says, good morning Traffic Radio and your guests. I know of a case of a cervical cancer stage 4 patient. She has undergone treatment, chemotherapy and radiotherapy. Results of treatment, chemotherapy and radiotherapy. So results of CT scan and MRI came back all clean. Should she still be worried about reoccurrence? Rachel from Agege is sending that one. Rachel, thank you.
So that is why we have a survival program in Medserve LUTH Cacner Centre, where when you have gone through treatment and you are in remission, you should visit your oncologist for routine follow-up, so that you can be monitored. After being monitored, we could follow you up in case there could be a sign of recurrence. It's very good story that that's a testament of the fact that it's curable even at a stage 4. So yes, the person is in remission, but we need to follow the person up and make sure that the person stays fine. And if there's any sign of a recurrence, no matter how small, so that it can be nipped in the bud.
All right. 08099120777. Let's have Dr. Eben Ajay from the Medserve LUTH Cacner Centre with us in the studios this morning, and we're doing some cancer advocacy, precisely cervical cancer. All right. Then this one says, sir, I took HPV vaccine for my daughter, but people are telling me it will make her promiscuous. Is that real or a myth? Grace from Yanokwaja is sending that one in. Grace.
Also a beautiful myth. A beautiful myth with the other myth of sterility. I haven't had this myth before, but it's a myth. It's not true. You've taken the right step by protecting your child. It's not a license. So it's based on the fact that, when the child knows that I've taken the vaccine, I can now do whatever I want to do. No, that's not the idea. The idea is preventive. The idea is safety, and it's not a license to go play wild.
All right. Lagos Traffic Radio, Ejigbo Corridor coming in from the control room says experiencing high volume of traffic. That's we're moving in from Ijegun Road up to Jakonde Gate, heading towards MRS filling station. It's high vehicular movement within that corridor. You have some failed portions of the road within that end, so it's making it slow. Immediately after that particular corridor, it is free, proceeding towards Kwako. Return journey from Kwako down to Ikotun roundabout. That entire stretch is very, very encouraging. And then we have traffic managers on ground doing the needful. Impediment very, very negative within that particular corridor. Talk to us. 08099120777. If you have any questions for the doctor in the building who is dissecting all of this for us, feel free to connect with us. Another message here says, good morning, doctor. Can a lady in her early 20s without sexual experience still be vaccinated? No name. Thank you so much. Okay, so is that possible?
Yes. Well, it's coming late, but if she hasn't had any sexual exposure, why not? She can be vaccinated.
She can be vaccinated?
Yes.
All right. Anonymous sender of this message, feel free to either take if it's your daughter or your sister, as the case may be, feel free to take her for vaccination. Now, these vaccines, where can people get it?
It's available in government hospital. I know it's available in LUTH, and I want to also take it for granted that it's available in all government hospitals. So please visit the government hospital, tertiary institution, and make your inquiries.
Is it free?
So I had said that the one in LUTH given to secondary school, up to secondary school age, is free. Okay. But if you're coming in as a full-grown adult, you may have to pay a token.
All right.
There are also private hospitals who give the vaccines. So, I mean, you avail yourself of the opportunity.
All right, then. Another message just popped in. This one says, good morning, doctor. I had surgery years ago for fibroid. It says, does that increase my risks? You didn't put your name. I would have loved it if you put a name to it. Doctor,
no.
Is that a risk factor?
No, surgery doesn't increase risk, particularly if you had surgery for fibroid.
Okay. All right. So you heard that 08099120777. So you just said it that treatment is available, right? And it can be cured.
Yes.
How long does this take?
Okay. So with treatment, if you're coming in for treatment, an average of 6 months. An average of 6 months, you can be done with your treatment on the assumption that there are no treatment breaks. You know, you can have, in 6 months, you can have your treatment and you'll be done with it.
Oh, okay. 6 months.
Yes.
Wow. That sounds very, very reassuring. And it means that there is hope, right?
Yeah, there is. There is hope.
Okay. All right.
It's for our citizens and our listeners to turn a new leaf and embrace the reality of the fact that, one, it's amongst us, then two, we can do something to curb the disease.
Okay. Something can always be done, right? 08099120777. Another one here says, good morning. Is the vaccine a one-time take or can it be taken multiple times? Rachel again. Okay, Rachel is reaching us again from Agege.
Okay, so there's those that can be taken 3 times. The Cervix can be taken 3 times. But NAFDAC has there is work that is being done for a single dose vaccine. All right, and that single dose vaccine, it was found out that it's equally as effective as the one-time vaccine. But the one that is more common is the 3-dose vaccine. The first dose 4 weeks later and 6 months.
Okay. All right then. 08099120777 09153877127. This one says, good morning, Traffic Radio. I am divorced and not sexually active again. Do I still need screening? Folake is sending that one in. Folake, thank you.
Yes, you can go for screening. There's the modern screening, the liquid-based cytology screening that can be done. You can benefit from that. And I think you can go for the screening, but you may not benefit from the vaccine.
All right. And how often should one go for this kind of screening?
Well,
how often?
If you go for the screening once and you're negative, and you repeat the screening and you're negative, okay, then fine, you stay in line. But if you're positive, then you need to have a check as often as you can to make sure that to make sure that you're good, right? And the disease is not resurfacing or occurring.
All right. All right. So, flash update coming in from the control room says that there's a report of a broken down loaded containerized truck having right front tire problem, and this is on CMS Bridge. All right. Those of you within that corridor might having it. You might be having it slow. So take note of that. Cones and caution signs have been put in place just at the location, so that you are very conscious, but you have traffic managers on ground managing the situation there. No casualty recorded within that particular corridor. This is CMS Bridge, so take note of that. Those of you that are within that particular corridor, that's the latest feed from the control room. All right, I guess Biodun is connecting with us again. Let me see. Biodun, that's from Adinho. Biodun says, lastly, does post-cervical cancer lead to the risk of having okay, let me get this proper. It says, lastly, does post-cervical cerclage, is there anything like that? Post-cervical cerclage, say, does it lead to the risk of having cervical cancer?
No, it doesn't.
Is there anything like that?
Okay, so a cerclage is a...
Cerclage, okay.
Yeah,
that's the word.
Yeah, that's the word. The cerclage is a procedure that is used to help to hold babies in the womb. So for women who have very low tone of pelvic muscles,
okay,
they are prone to having first or second trimester abortions.
Oh, so they use the cerclage.
So the cerclage is a suture that is made around the around the neck of the womb, the uterus, to hold that baby. Yeah, in place.
Okay. So is there any connection with that and cervical cancer?
There's no connection.
All right. Biodun, you seem to be very experienced, but thank you for asking those very, very pertinent questions as we gradually wind down. So, Doctor, even though we are doing this awareness month, one of what we're doing right now is this advocacy. Any other thing that the Medserve LUTH Cacner Centre is doing?
Okay. So with Medserve LUTH, you can come to Medserve LUTH to screen. Very important. You can come to Medserve LUTH for actual treatment. You can come to Medserve LUTH for prevention tips. We have a prevention arm that can help you, that can counsel you and counsel the family. You can come to Medserve LUTH for genetic counseling and genetic screening. And you can also come to Medserve LUTH for follow-up, for a survivorship program.
Right.
So we walk you through post-treatment survivorship to make sure that you live well and your quality of life is good.
And where's Medserve located?
Medserve LUTH Cancer Centre, obviously from the name, is located in the Lagos University Teaching Hospital. That is where the cancer center is located. That's
Idiaraba.
Idiaraba, sorry.
All right, then we'll leave it at that for now. What's your message? What's your parting thoughts for our listeners this morning?
Okay, so your health is as important as your house, is as important as your asset. So the same energy we spend in having to making sure that our assets are kept should be the same energy we should commit to our health.
All right, we'll leave it at that for now. It's nice having you in the building.
Thank you very much.
Okay.
Glad to be here.
Always a thing of joy to have Dr. Eben Ajay. And the flash update from the control room says within the Oyingbo corridor, traffic is still very heavy on Oyingbo Bridge inwards Oyingbo proper down to Ilele. And this is due to the market activities at this time. Traffic managers on ground managing the traffic at that particular location. We have to go. The program has been produced by Dayo Anthony, and I say a big thank you to Onora Moluku, who's a cancer advocate. He's been doing a whole lot in terms of education and advocacy, trying to ensure that we connect with you, the listeners, and then empower you with the tool of knowledge. Remy Aluko is of our social media unit. Maximum shout out going out to him and to our executive producer, Tayo Akonle. My name is Victor Oteri. I'm out, still very much within. I'll be back shortly for the benchmark.